The first step in the procedure is to create a pilot hole along the long axis of the proximal phalangeal bone. To do that, we use the hand-driven drill and go on the center and apply a twisting motion. There is a physical stop on the drill itself, so you cannot drill beyond that level. What I have here is a pilot hole in which I am going to insert the proximal implant or the proximal screw, which is purple in color. So that's my proximal implant or the proximal screw. I'm going to load that onto my screwdriver and insert until the head of the screw sits flush with the surface of the bone. Again, the screwdriver is designed to have a physical stop. You can insert it only to a certain level, beyond which the screw will not go. That shows my proximal screw being inserted in the proximal phalangeal bone. The next step in the procedure, which is optional but very useful, we have what we call a small transfer guide pin. It's approximately ½ an inch in length and has a trocar tip. The second step is to insert this pin with the blunt face going into the screw, such that the sharp tip is left exposed. At this point, the surgeon can distract the middle phalangeal bone and cross it over the pin in the orientation in which he wants the final toe to sit, and push the middle phalangeal bone onto that pin. So this will give me the final orientation of device placement. Once that is done, the surgeon can distract the middle phalangeal bone and the guide pin should be transferred on to that bone. If the bone is too soft or mushy, that pin might not get transferred and you can physically hold it and push it at that same location. Following this step, we use the Trefine tool, which is cannulated over the transfer guide pin to create a pilot hole. The Trefine has a laser mark indicating the depth to which it needs to be inserted. Following this step, you will notice that when the Trefine is pulled out, the transfer guide pin gets lodged inside the Trefine, which is absolutely okay, since this tool and the transfer guide pin are both disposable, single use only. At this point, you are done creating the pilot hole in the middle phalangeal bone. Now also note that for a surgeon, to save time and if they are confident of finding the long axis of the middle phalangeal bone, they could use the same drill and create the pilot hole freehand in the middle phalangeal bone. So you use either the transfer guide pin along with the Trefine or the drill alone to create the pilot hole in the middle phalangeal bone.